Y'all, we're fixing to dive into all things ICL surgery, so buckle up. Let's go. Welcome everyone. I'm Jeffrey, and 3 months ago I had ICL surgery. So if you were like me and you were not a candidate for LASIK, or there's another reason why you're considering ICL, you are in the right spot. I'm going to answer all your burning questions today. And at the end of the video, I'll let you know how I feel about my surgery. Am I happy I did it? Do I regret it? We'll find out. First of all, what is ICL surgery? Well, ICL stands for Implantable Collamer Lenses. Implantable Collamer Lenses. Some people, I think, incorrectly call them implantable contact lenses, which is what they are, but their technical name is Implantable Collamer Lenses. They are permanent contacts that are put in your eye through a quick surgical procedure. It is a surgical procedure, but you're not like out with anesthesia, and it's pretty quick. What they do is take this contact, it's soft and pliable, and it is rolled up inside this little device, and they make a small incision on the side of your eye, and they kind of like squirt it. They like push the contact in, and it's all folded up when they push it in, and then the contact unfolds itself, and then they just go in and position it. It's like a rectangle shape, and on each of the four corners there's these little tabs, and they tuck those tabs up in front of your iris. So some people might get this confused with a very similar but very different surgery for cataracts. In that instance, it is similar, but with the cataract surgery, the implanted contact is also replacing your lens. So your natural lens, I guess, is removed. I don't know what they do with it. All that to say, it's not the same thing. It is similar, but it's not the same thing. ICL surgery is much easier, faster, less invasive. It's kind of shocking how easy it is, actually. And we'll get to this, but if you want to have them taken out, it's a quick 10-minute trip to the eye doctor. They can take them out very quickly and easily. After I did my consult, I found out that I unfortunately was not a candidate. I have a mild case of keratoconus, an eye disease. Not something that needs to be stressed about in the close term, but it does mean that I am not a candidate for LASIK. So the only other option, or the next best option, I should say, was ICL surgery. Is ICL surgery safe? Yes. Very safe. It is a relatively minor procedure, and the success rate is around 98%. And now that does not guarantee that you will have 20/20 vision after. It will almost definitely be improved. Mine was 20/20. Some people achieve better than 20/20, but that is not guaranteed. And that's one of the risks. There are also risks around, like having eye pressure issues afterward as well. It's also a surgery. There's, an infection. Like, there are risks that you can find online, but overall, it is so safe compared to other surgeries. It is certainly among the safest. So, is ICL surgery permanent? Usually, that's the goal. The goal is that they'll never need to be changed, but it is possible, and if so, it's a pretty easy procedure. Like I said, they just quickly pull them out in 10 minutes. The downside of that is if you want to have new ones put in, you have to pay for it and go through the procedure again. But the goal is that they are intended to be left in for the rest of your life. So, who is ICL surgery right for? Well, first and foremost, the FDA has only approved the operation in the USA up to the age of 45. So if you're over 45, you won't be able to have that surgery in the US. A few things that are important to note. Number one, ICL surgery only corrects for nearsightedness. So if you can't see far away, it will help correct that. The same thing as the same way as your normal contacts. So if you are nearsighted, they will help replace what your contacts and glasses are doing. For reading glasses, for reading close up, it does not fix that. So as you age, if you are going to need reading glasses, you will still need reading glasses. The ICLs, unfortunately, do not correct for your ability or inability to see close up. Why Mexico? Well, I had my procedure done at the Codet Vision Institute, and it's in Tijuana, just over the border here. And if that sounds scary to you or unsafe, I understand why an American, based off of what we know about Mexico, I understand why you might think that. But that's flat out wrong. Mexico has incredible healthcare. They have an incredible healthcare system, and the facility I went to, the Codet Vision Institute, is one of the most well-regarded eye surgery centers in North America. So if Mexico sounds scary, it's not. It can be. I heavily vetted doctors and facilities, and I could not possibly be more happy with the experience. It was lovely. I live in Southern California. Medical tourism over the Mexican border is very popular here. They have some incredibly high quality dental and eye care facilities at a fraction of the cost. So it's very popular for us near the border here to go to Mexico for things like this. At this facility, LASIK was around $3,500 for both eyes, which is, depending on where you live in the US, either significantly cheaper than the US or dramatically cheaper than the US. My ICL surgery was around $7,000. So, double the cost. So that was a hard pill to swallow at first. And I initially, when I found out I was not a candidate for LASIK, was not on board with ICL surgery, mostly because of the cost. In the USA, LASIK costs can vary widely, but ICL surgery tends to be around $3,000 to $6,000 per eye in the US. In Mexico, again, at one of North America's best rated eye surgery facilities, it was $7,000 for both eyes. And so some pretty significant savings. So what does surgery day look like? Well, the facility sent a driver to come pick me up where I was staying in Tijuana and brought me to the facility. And I checked in and then did some initial tests and screenings and things. And they had already ordered my ICLs a couple months earlier. They do take some time for them to be manufactured and to arrive. They got me prepped for the procedure. I had to go into a hospital gown and all that jazz. I'm not completely clear on the anesthesia. It's not anesthesia. You're not out. They maybe just gave me Valium. I don't know. It's a light anesthesia is what I would call it, if that's a thing. You're like out and drowsy and loopy, but not out. Then you have your IV drip put in, and then you go to surgery. And it's all very fast. The procedure takes maybe 15 minutes, something like that. Very, very fast. It is a weird sensation to have them touching your eye. The first eye I did on a Wednesday, and after I got out of surgery, they were pretty worried because I guess during surgery, they kept giving me instructions on, hold your eye open, look to the left, and I would do it and then immediately fall asleep. And, that was wreaking havoc on them completing these micro level adjustments as they're inside my eyeball. So for the second eye, which was 2 days later on Friday, for the second eye, they used a local anesthetic so that I couldn't move my eye. And both eyes were fine. They were worried about that first eye, but they took a look afterward and everything was great. And that's that. I had the first eye on Wednesday. I went for a checkup on Thursday to make sure that eye was looking good. On Friday, did the second eye. On Saturday, had a second checkup on that eye, and I went home. What is post-surgery like? Well, you have to wear this protective thing over your eye, a shield, a clear shield, basically, just to make sure that nothing hits or touches your eye or gets inside your eye. They've made tiny incisions in your eye, so you're also using antibiotic drops just to prevent infection. But the first 12 hours, things are cloudy and hazy, and halos. We're going to talk more about halos, but the halos were severe. I had my first eye surgery on Wednesday. It was 3 a.m. that night. The next morning, I got up to go to the bathroom, and when I opened my eyes, I could see out of my right eye. It was still healing. It was still a little cloudy and still a little blurry and things, but it was starting to heal and come into focus. And it was such an exciting moment in that bathroom. So the next day, it was a lot better. It feels weird. There are some sensations. It doesn't hurt. I would say never was there pain. Really, the most painful part was getting the IV put into my hand. It really was not painful even afterward. So for the next couple days after surgery, it has made great improvements, but it was still not at 100%, and the halos were still pretty rough. But within a few days, I could see pretty well. I was still using antibiotic drops, still using lubricating drops. You do have to be careful for a number of weeks afterward in terms of physical activity. You can't get in pools or in water. You have to take a few minor precautions after surgery. But the recovery is pretty chill, to be honest. At 6 weeks, I had a checkup to make sure everything looked great, and to check my vision, and everything looked great. And I had 20/20 vision. I also had seen a huge decrease in the halos. So the halos, it is an unavoidable downside to ICL implantable columnar lenses. Halos. If bright, it has to be bright light. So if you're driving at night with street lights, or if you're in a dark room and you're on your phone, if there are bright lights hitting your eyes at the right angle, it creates these very prominent, glowing halo rings. They aren't super distracting, but they're distracting. And at 6 weeks, those had greatly reduced. Which I had just kind of accepted. I knew that was a downside, and so I had just kind of accepted that that's going to be the rest of my life. The halos were not, they were a minor inconvenience for the ability to see. But they continued to get less and less, and they have continued beyond 6 weeks. I'm now at my 3-month mark, and they are nearly imperceivable. I rarely see them. So those do reduce as your eyes heal. One of the first questions I get is, what happens if your eyesight changes? Well, first and foremost, eye surgeons, I think it's different for each eye surgeon, but they all want your prescription, or at least your ability to see or not see far away, to have not changed in a handful of years. And the whole reason for that is that they don't want to put the ICLs in and then your vision immediately change. Because your burning question, what happens if your eyesight changes? Well, you have them taken out, and then you can have new ones put in if you want, but that is pretty unlikely. So, am I happy with it? Yes. We're at 3 months out, and I'm ecstatic. It was great. It could not have gone better. It exceeded my expectations, and most importantly, I can see. I don't have to wake up and put contacts in. I don't have to search for my glasses in the morning. When I'm trail running, I don't have to deal with trying to keep a contact clean in dirt and grime. I love it. I am so glad I did it, and I would recommend it to anyone. I would also highly recommend the facility where I had my procedure, Codet Vision Institute. Not a sponsor. I paid full price. Well, I think I got a $200 discount because they're running a promo. But I paid normal price for the procedure, and these are all my opinions and my opinions alone. So, what do you think? Would you have ICL surgery? Be sure to let me know what you think, or ask your questions in the comments. Additionally, if you have not watched my 2 episodes chronicling my journey to have ICL surgery, I'll link those in the bio, as well as the Codet Vision Institute, the facility where I had my procedure. Again, not a sponsor, but I couldn't possibly have been more happy with my experience and would happily recommend them to others. Don't forget to like, subscribe, smash that bell notification button, do all the things, and we'll see you next week. Bye, y'all. Want to watch another video? Click here. Want to learn more about my upcoming trips? Click here. Want to subscribe and like all my videos and turn those bell notifications on?